I'm Jason Defee. I'm an orthopedic surgeon here. I am proud to be, in our department here. I think that our department does a really good job. For a small hospital, we got a lot of providers on the ortho side. So I think we're able to offer the folks in the Valley, just about the full spectrum of orthopedic and musculoskeletal care. I think our staff, both in the office, in the operating room, the nursing staff up on the surgical floor, the folks we work with through the ER, I think the relationships are good, so I enjoy working with the people that are here. Since even we're in a small town and we're in like a rural setting, I still think we need to keep up, technology-wise. So this is a unit made by a company called Ortholine. I use these during my knee replacement surgeries. Dr. Carissa Trippi, my partner, uses a similar unit during her hip replacement surgery, so we can use them for both. The things themselves, it's kind of interesting technology because there are little accelerometers inside the unit, which basically kind of measures like motions that we are making when we're preparing to do the surgery. And then the computer itself takes points that we tell it on the femur or on the tibia, and then our movements allow it to kind of calculate where the center of the bone is. So this is a video showing the knee aligned system. This is now showing what we do on the thigh bone or the femur bone. Again, there's kind of a mechanical jig that mounts on, and those are pins showing that happening. And then we're using that same unit attached to the femur bone. We make some movements of the hip, and the machine is able to calculate where the center of that femur bone is, and then we are able to adjust the cuts themselves or the alignment of the cut that we're going to make. And this is really kind of patient specific. It's based on the patient's own anatomy, and that's one of the best things about using this unit is it's kind of tailored to each patient. And again, the alignment of that cut is based on the information that we gave the computer, and that's kind of what it looks like before we put the implants in. There are some advantages to not using some of the intramedullary guides or some of the jigs where we have to drill extra holes in the bone, that we don't have to do that using this type of system. I feel like at this point in my career, I've navigated enough surgeries and we've used this specific unit enough that it probably goes even faster than just doing it the traditional way, so the patient's not under anesthesia as long and everything like that. A knee replacement, a hip replacement, any of those surgeries, we're going to give you the best knee or hip that we possibly can, but it might not be as good as the one that you had when you were 20. Our goal is to give you a joint that doesn't hurt and allows you to do the things that you want to do. It seems like folks always think that they're going to get better care when they go to a bigger place. And sometimes that's true with very complicated stuff or rare diagnoses, but I think not only our department but our hospital can handle the vast majority of folks' medical problems, especially their musculoskeletal or orthopedic problems. So I would encourage people, even if you think that you have a condition or a problem that we can't handle here, number one, we may be able to, so give us a chance. Number two, if we can't, we probably know someone and may be able to help you get in with someone that would be a good next step instead of you just trying to find it on your own. We are SLV Health.